When we think about AI in the hospital, we usually imagine science fiction, a supercomputer diagnosing rare diseases, or a robotic arm performing pixel-perfect surgery. 81% of physicians are already using AI in their professional practice, but the nature of that adoption is far more practical than the futuristic tropes suggest. Doctors are turning to these tools for administrative relief. They are using AI to escape the crushing weight of paperwork defining modern medicine. The shift happened because the system was drowning. AI wasn't adopted to replace clinical judgment. It was adopted to survive this suffocating bureaucracy. Within the industry, it is known as pajama time. These are the late-night hours doctors spend at home, finishing charts into the early morning, because there wasn't enough time during their actual shift. 95% of practices report a steep upward trajectory in administrative burden, pushing the system into a red zone. To keep up, 40% of clinics hire multiple full-time administrative employees per physician just to manage payer audits. The overhead required to practice medicine reached a mathematical breaking point. The system became unsustainable without a technological intervention to handle the clerical load. AI usage in medicine more than doubled in 3 years, leaping from 38% in 2023 to 81% today. The average physician now utilizes 2.3 distinct AI use cases every single day. The most significant driver of this shift is the rise of ambient AI scribes. These tools listen to the patient encounter in real time using voice recognition to automatically draft clinical notes in the background so the doctor doesn't have to type during the exam. The impact is massive. Physicians report 80 to 90 minutes of after-hours charting is being compressed into just 12 minutes of review. This data from JAMA Network Open tracks the result of that time savings. It shows a cliff-like drop in physician burnout, falling from 52% to under 39% within the first 30 days of using ambient tools. By neutralizing the data entry bottleneck, AI is allowing physicians to reclaim their personal lives and their clinical focus. Beyond documentation, AI is being deployed in the ongoing battle over prior authorizations. The legacy system of insurance approvals costs the industry $35 billion annually and causes care delays for over 90% of patients. Practices are now using AI to automate the clerical steps of the process, verifying requirements, tracking claims, and correcting errors before they lead to denials. The CMS WISER model is a pilot program showing the federal government now uses machine learning to conduct its own Medicare prior authorization reviews. New federal mandates follow this shift, legally requiring health plans to meet strict 7-day turnaround times for standard requests. The slow back and forth of fax machines and phone calls is being replaced. These strict new deadlines make a robust AI infrastructure an absolute baseline requirement for any modern medical practice. While the adoption is rapid, it is driven by necessity. Physicians still have significant reservations about the role of AI in clinical settings. 88% of doctors demand robust data privacy and strict safety validation before trusting these tools. Additionally, 70% fear skill erosion, concerned that medical students will rely too heavily on automation and lose their raw diagnostic instincts. AI's permanent place in mainstream medicine depends on the establishment of guardrails that support human judgment rather than attempting to replace it. We are seeing a divide in the industry between stagnant practices drowning in paperwork and modern practices adapting to this new baseline. The most successful clinics are building hybrid teams, combining HIPAA-trained virtual assistants with high-speed AI automation. This strategy prioritizes resource reallocation, using technology to handle repetitive clerical tasks so that human staff can focus entirely on high-value clinical work. By stripping away the administrative bloat, these tools allow physicians to reclaim their primary role, the human connection with the patient.